Hey, I want to welcome everybody here to Her Health. This has been a mini series in which I have been featuring Miss Shara Lewis-Campbell, S. Lewis Campbell, as she is known out in the world of books, books and brands. I love it. That's what we're going to be talking about a little bit, but I want to jump right in because I think what we're today's discussion, and this will be the third discussion in this mini series, is about three of them. So we're going to kick this right off in I would call plain terms. So when folks, people, they hear about AI in healthcare, what do they usually picture? And that's what we're going to be talking about. What's the reality on the ground, especially for Black women? So sure, you like to kick us off and kind of like just jump into that question 2 feet. What do you think?
Well, thanks again for having me. I can't believe that we're like halfway into the podcast series already, and obviously we missed a week last week because of the national holiday there. So it's really great to be back this week. So yeah, I mean, your question is a very important one. And I would say in terms of people's thoughts around the future of AI and how that relates, to healthcare currently, especially for Black women.
Mhm.
I would say this: when you think about it hypothetically, you probably are thinking very positively because a lot of us already know that AI is already ever present within medical. Treatment, as it were, in terms of early diagnosis, in
Mhm.
terms of assisting with data and even keeping of records and things of that nature. However, in the stark reality is for Black women, there is a huge sort of mixed consensus because in terms of AI, the data is very skewed because the data it would appear from the research that it presents is that we're all in great health when we know that in contrast, just in terms of the conversations we were having in the previous episode, um, one in three Black women in this country, are dying due to mortality rates. Sorry, one in four. And over there, it's one in three, So, how can we be in a great state in terms of the data that we see presented by AI, and we know that the way that things are at the moment, it presents quite a dangerous situation because the female voice is not being heard. I mean, when are we even told that AI is actually helping with our medical treatment, and a diagnosis, etc.? It rarely happens.
I think this is important. I did my own study and meaning asking questions about is there a bias in the data, as you said? Is there a bias in the data? And people, and I encourage you, look at some of the comments that I put into this particular LinkedIn event. And I'll read a couple of them to you because I got my little phone here so I can see it. But it was disturbing to me. It says an AI system used to read x-rays and mammograms, and that was found to be up to 20% less accurate for Black women because the training images were overwhelmingly white patients, right? So it only learns from what it is given. Here's another one in cardiology. Some AI tools for detecting heart attacks were built mostly on data from men. So when women, especially Black women, came into different systems, the AI missed the symptoms. This is, this is very, very important if we're, depending on these tools for this accuracy, and then understanding that the data that is given is not that great. Here's the last one. I got to say that because it really floored me. Did you know that one of the most widely used health risk algorithms in the US once predicted that Black patients were healthier than white patients with the same illnesses simply because less money was spent on their care. So it came to that kind of conclusion, was obviously is wrong. So we hear that AI is neutral, but we've shown that it actually does carry bias. And for someone who's never been thought about this or taught about this, my question to you is, how does bias even get into these systems?
I would say it's quite easy to achieve bias data if you exclude various groups. You know, if they're not part of the conversation and they have no way of contributing to it, um, the data is going to be misinformed. I mean, just in terms of some of the statistics that you've read out, it's quite harrowing to think, that. And I wonder, even it's quite harrowing that it's more or less become very much like a stereotype. But I think that even in general, we've all started to believe that we have better health, than other groups, because we are just not even in the equation, to think otherwise, when it's actually the quite the opposite, really. We are just as in need as the next groups, and should be taken as seriously.
Well, when you're driving the car, let's say you got to look at all the passengers in the car, not just the driver, right? And a
Mhm,
lot of these algorithms were just built by certain groups, and they're not thinking about this. It's like, it
mhm,
doesn't come up, because it doesn't affect you directly. But some of these stats, obviously they blew me away. Now, you're thinking about black patients had to be sicker just to get the
mhm.
same help. You're like,
Yeah.
wow, this is not good.
Mm.
So how does that slip through the cracks, and who's standing guard to fix that, in your opinion?
Um, I think how it slipped through the cracks is because of the fact that you've just got really a certain particular group, which is white males that are responsible, for the policy making. And in terms of the tech companies, they are very much, in line with that group, And what we need is, rather than having the two groups, creating all this infrastructure, around the future of the healthcare model, what you need is a tertiary system,
Right.
where you've got the minority groups, that are able to present data, and who you can get data from to make healthcare more equitable for everyone, you know?
This is important. Accountability,
Mhm,
responsibility, understanding once you release something into the wild, and you've got to be accountable for that. So if you've got a whether it's an algorithm, it's a software, it's a type of technology, you're responsible for it,
mhm,
right? And if you know that is giving out some very wrong information, like, hey, that's not correct, you have to take responsibility to correct that. And if you don't, then you're liable for that. We're starting to see more and more consideration in that area of ethics, and certain regulations that are going to be, they're coming out. I've seen some things in Europe that are coming out. The U.S. is also, and I think other developing countries are starting to see that, because as you see in other, it's not just one world. This is a whole
mhm,
planet of people,
mhm,
and if we are start utilizing certain tools, we've got to make sure that it's made for a very diverse type of environment, and not just one way. But we've got to look at and take more responsibility of creating some of these tools for ourselves. Like I have suggested before we got on this call, we as a people have to engage. The more you engage, the more information that these types of machines gain. And when they
mhm,
become more knowledgeable, they can begin to be a little, less biased in their approach. But we've got to be very, very intentional about that information that we're putting out there, so it's not so skewed, right?
mhm,
Very, very important. So I wanted to ask you, Shara, if you didn't mind, if you don't mind, because you've shared some really good things in the past about real life moments. But this is
mhm,
about a real life moment around AI, was
mhm,
supposed to help, but ended up hurting Black women instead. What
mhm.
does that look like, whether it's in an exam room or something else, in your opinion or your experience?
Mhm. So, I mean, from some of the research that I've seen, in cases where females required the same sort of solutions to like chronic illness that they were going through, it similarly to female patients. Because the data wasn't available for Black female patients, they just missed out completely, and therefore less money was spent in that area, and less seriousness was taken, in that area, and all the focus was put on, the white females that were suffering chronic illness at that time. Now that can't be right. I mean, chronic illness, as you know, leads to death without treatment.
Mhm.
So something as serious as that, I mean, it couldn't get any worse, could it? And for them to just be marginalized in such a way and just ignored because the data wasn't there to accurately present itself as it was able to for those fortunate groups that did receive, treatment for their chronic illness. Unfortunately, it wasn't the same for that other group.
This is what is we have to address these things. I talk
Mhm.
to speak to the elephant in the room. I think a lot of people don't realize that the healthcare system, even as I've learned, even the world healthcare system was not built on everyone's data.
Mhm.
Even right now,
Yeah.
certain medications that you're taking, they were made on the clinical trials of a certain set of people, not everyone. So, and we understand now that certain things don't behave the same way in certain people. So you make these huge assumptions. So the question then becomes: Are we creating an even bigger monster by utilizing these AI tools that are unchecked? And I don't even know. And like I said, being completely honest or transparent, do we really know if AI is deciding your care or not? Or should we know if an AI is actually behind the decision that was made? And do we know how to make that clear? What do you think?
Well, I think medical treatment for the future is relying on AI even more so, and as I say, from the Google treatments, like where I see, the younger doctors relying on, Google searches, to come up with solutions for healthcare for patients. It's very much the same situation for AI tools, and I personally feel like the only kind of solution that I can see really working is one where everyone is feeding in, and presenting their data from all groups, so that you can get accurate readings and accurate diagnosis. And that is just where it all should start and end. And I think there needs to be greater responsibility for policymakers and tech companies, and there must be more input as well, from patients, a much greater input than we're seeing at present. And I think, should we have that, and that should be the aim, but if we are able to achieve that, then I think we can see things even expanding even further, whereby we can see more of an equitable, universal type of treatment that I would like to see, because I think it's the only kind of solution. I was speaking to a very dear contact that we both know, which is Susan Howell, yesterday, and we kind of came up with the agreement that we need to have one universal medical system for everyone throughout. It's not something that we should have to pay for. It's something that we should be entitled to. You know, that's where humanity needs to start. You know, and I
I
think
think
that if
there's a lot of validity to what you just said. Just understanding, just like here's an example. We have a great example. We had COVID. Now, COVID didn't affect just one group of people; it affected the entire planet.
Mhm.
And because we had to be responsible for uh, handling that situation as a planetary human species, right? We all had to address it. It shut all of us down. It wasn't just
Mhm.
shutting some of us down. So we got to look at this thing and take responsibility as a planetary entity, and not just I'm a part of this country or part of this culture or part.
Mm,
I always looked at it like, there's a certain maturity we have to start getting to and start
mhm,
understanding like, okay, we if we don't address this as a human problem and not
mhm,
just as a particular, subset problem or cultural problem, we're
mhm,
going to run into a lot of issues as we go along, the
mhm.
continuation of life's way. Now, one thing I do like, I'm not like all like bashing AI. I am not. I think
No.
AI is what it's doing is
Mhm,
that it's showing us our blind spots. It
mhm,
really is showing us our blind spots, and it's an opportunity to correct some things that if
mhm.
we don't get a hold of this, like you know what? Because if humans are programming the algorithms, which they are, and we know
Yeah.
humans are fallible, they make mistakes. They're not
Mhm,
perfect, right? But once we understand these things, like, okay, it's showing us where we're imperfect. We definitely need to make some, and we can program these things. We are in control of that. Let's make it so that it's more inclusive in what the determinations are coming through. So you begin to see these things and make sure that the tech is fairer, right? Because others fear
yes.
that AI will actually just end up pushing us further apart or even replacing real doctors because they're all looking at the money. I just
Mhm.
want to understand when you land on that. I mean, can you weigh in on some of that information I just gave?
Yeah, I mean, in my humble opinion, I don't think I think that I see AI as being a really supportive tool. It shouldn't be considered as a replacement, we're seeing in some other industries. It should be. It's not about replacing doctors or anything like that. It really is about having the most accurate information to support those that are actually doing the work, undertaking the work, so that they can be perform better surgeries and have better results. Um, but without having that accuracy, we do run the risk of seeing more misdiagnosis, and seeing it going down that negative, path that we're all trying so desperately to avoid, and I think it will also, by seeing that union of all the parties that need to be all part of the infrastructure to make it better, I
Mhm.
think we could really see some really dynamic things happening, people living far longer than they are currently, and being treated earlier as well for symptoms.
I agree with all of that. We need to understand the dynamics that are all on
Mhm,
the table. You have your what I call your nation states. And for
mhm,
instance, like you're in Great Britain, I'm United
yeah,
States. That's just an example of a nation state. Then you have what I call your tech states. Now, your tech states are things like a Microsoft, a Google, a Facebook, an eBay. These things, these technical entities cross borders. They're all over
yes,
the world. So they're not
mhm,
dependent on just one country. They're all over
right,
the place. So you have your
yeah,
nation states, your tech states, how they utilize those powers, but then you have people.
mhm,
Where are the people at? And if we don't voice ourselves within these dynamics, these entities will continue to control the
mhm,
human experience.
yeah,
And they should be enhancing the human
mhm,
experience or working in conjunction as a collaborator of
mhm,
the human experience. Unfortunately, sometimes they fall into the control aspects of things. And then you start to like, wow, I'm starting to see myself left out of the situation. That's a choice that some entities make. But if we as a people start to like, you know what? I want a better experience. I want a more real wander experience. You start to ask that question, was this made for people like me? So if we really
mhm.
want to help Black women when it comes to AI, where do we start first? Is it policy? Is it tech? Is it companies, hospitals? What do you think should take the lead in your view?
It starts with the person, with the patient, we're having these discussions, they're very vital. And, when you're next routinely seeing your doctor, ask them, where's this data coming from? You know, has AI been involved in making this diagnosis? If we don't start asking the right questions, we won't be in a position where we can add to the conversation and be a part of it, you know?
100%. And I always go back to this stat that always floored me in today's healthcare realm, and I can only speak to the U.S. There are medical errors that occur every single day.
Mhm,
I don't think we really understand the impact of that, in which I always put it in the analogy that so people do understand this. It's just like if two giant jumbo jets carrying about 300 people approximately in each jet
mhm,
crashed every single day, killing everybody on board. I think there would be an outcry. You'd be like, oh my
mhm.
God, what is happening? Our world is coming apart. Two jumbo jets
Yeah.
every single day. This is
Mhm.
happening every single day
That's
in
right.
the U.S. healthcare system because of medical errors. Now,
Mhm,
I would love to see AI come in and say, "Hey, we can reduce medical errors because we've deployed the tool accurately." To your
mhm,
point earlier, you're saying, "Hey, why are Black women dying? The mortality rate I don't know, it's like 30% higher or something to that
mhm,
effect." That's just in normal traditional medicine. What is
mhm,
the error? What is happening? Can we start deploying more precise medication, precise
mhm,
medicine, precision medicine? So I see the use case could be better, but we have to take responsibility for what is happening, everyone, not just one group of
mhm.
people. But I do
Yeah.
want to ask you this, for any Black woman that's watching this right now, what can she do? Does she feel like the system or the system's technology is failing her? And
Mhm.
what questions, as you said earlier, what questions should she be asking her doctor? Again, help us
Yeah.
understand that.
Yeah. Well, to be honest with you, currently, our data is not in the system.
Mm,
Okay. So at the moment, it is failing us because it can't diagnose for us accurately because
mhm,
there's not enough information about us feeding into the system as it is for other groups. So therefore, these machines and technology are only working towards the groups that it does have data for.
mhm,
At some point, you're going to need medical treatment, so ensure that you are educated, as to what's happening, what is the future of medical treatment looking like, for you as a group. And, speak to your local practitioners, when you're next in the hospital, ask the right questions, how has this diagnosis happened? Can you take me through it? Where was AI, or if it was responsible in any part of the diagnosis? How did it come to that decision? When you know that there is a lack of representation for us within the data, how is this information supplied? Because if it's supplied to you based on another group,
mm,
it can't really help you, can it?
mm. What you just said there, as a lot of people say, that part, right? That part. And you wonder why,
Mhm.
you go into a healthcare situation, you come out with something else, you wonder how you got
Yeah,
it. And
that's
then
right.
sometimes there's side effects as we hear or
Hmm.
certain things. But if it was never tested, on your particular physiological, that's a big word for me. Just your physical makeup. Let's just say,
That's right.
you're like,
Yeah.
wow. Then it's kind of a test and hope and pray kind of thing.
Hmm.
So we want to try to mitigate some of these things. But here's the ideal question, and I'm going to ask this to Shar. Before we close out. Now, I want you to paint this for us. What does better look like in your opinion? What does fair, bias free AI for women's health actually mean in real life?
It means being involved, being a part of the conversation, demanding, fairer treatment, and access to medical treatment. That's what it means. It means better education. It means that you need, as a person, as a patient, as a possible patient, potential patient in the future, to take ownership of your health, you know and this is a part of that. It's not just about going to the gym and looking good and eating all the right foods. It's ensuring, that when you should need medical treatment, there is some information there that you will have access to.
100%. And this is what we need to understand, even in our current systems. And I've learned this from different executives in the healthcare system, certain tools. They're not necessarily AI, but they're just tools. They were not made for certain pigmentations of skin, meaning it gives a different reading. It
Yeah.
just they weren't engineered for that. They were only engineered for a certain look and feel of a human being. And as we know scientifically, humans are humans. You
Mm.
are human. I mean, your blood, all these other things. However, there are certain those things that are different.
Mhm.
They're different, and if you don't engineer for that, you're going to get different results. And either you have to ask yourself, "Am I okay with living with that? Am I
Mm.
okay with living with that?" Those things that I talked about earlier, about those specific biases within the AI um, database itself. Am I okay with the fact that it's going to tell a certain healthcare professional, oh, this person doesn't need a certain diagnosis or a certain medication because the data is telling me that they're healthy or
Mm.
they're wealthy when they're
Yeah,
not. They're giving false readings, even though it's
that's right.
correct with this
Mhm.
programming, but totally incorrect in real life, right?
That's right, yeah. And that's the risk, you know. I mean, there's a danger for us being misrepresented, you know. There is a real danger of that. And because it's currently what we're seeing. You know, it's great that everybody's excited about this AI, but I suppose as a demographic, probably us least so, because we don't benefit from it, you know, in the way that everyone else is.
This is where we gotta take responsibility, have a voice. This is why
Mhm.
me and Shara are on this particular mini series. We want to bring a voice to the voiceless,
Mhm.
to be able to say things a lot of people don't want to say out loud for fear of this or that. I don't have that type of fear. I'm a brave person, right? As part of my system, the brave system. And so you have to be brave, and you just have to speak up for yourself
Mhm.
because you are deserving of better treatment, better care. And if you don't point these things out, most people is like, "Oh, it must not be a problem because I'm not hearing anyone rebut or voice dissatisfaction." Some people do that because they just don't know. They're
Yeah.
just unaware. Like, I didn't know I could
Mhm.
get a different result. I just thought, that more, black women were dying in maternal health because that's just the way it is. I don't think so. I think there's
Mm.
something wrong with how we're treating certain people in the society as a
Mhm.
whole that's determining that outcome because it doesn't make medical sense, in my
Mhm.
opinion.
Agreed. Yeah, I couldn't agree more. You know, we are missing from the conversation, and it's really vital, you know, that we speak up because I mean, even through this series, I've heard from so many that have stated that, you know, either they themselves or they know of people or they have relatives that are suffering in silence, you know, because they don't have access. Either they don't have the access, they don't have the resource, or they don't have the information, you know. So as part of this series, I ask everyone to just really step up and take some ownership, you know?
100%. Before we let you go, we got to make sure that because the audience is like, all right, how do I get in touch with her? This is so important. I don't think a lot of people also remember that you are an author, yet you've written,
Yes.
a number of different books, and we are going to continue to have some. Matter of fact, she's helping me with a project that you'll hear more about later. But before we let you go, Shar, you got to let us know how to contact you.
Yeah, sure. If anyone wants to reach out to me, they can do. Please email me at ink@reinc.art. It's that simple.
Excellent.
And I'm also available on LinkedIn as well, just to say as well.
No, no, you're very, very active. I really like that. Again, you are in London, and we like the fact because we everybody's experience is a little bit different.
Mhm.
You've educated us on what's happening in the London, or there's two different healthcare systems depending on what you're going to get, and
Mhm.
it really kind of depends on your socioeconomic system or status
Status,
and
yeah.
what you can access. And I think it's almost the same also in the United States. So you got enough money, you can get better care. So I
Mm.
don't know if that's good or bad or indifferent, but we need to bring these things up and see if we can get a
Yeah.
better result. So thank you
Mhm.
again. You can reach all me also at 5starbdm.com for anything in the future related to Grant McGaugh. So thank you so much for being with us. Bye bye.